We are now in the second quarter, but before we start with our lesson, let's read and answer the pre-test. Read the question carefully. Previous topic about marriage. Let's answer the recap. Fill in the blanks by choosing the appropriate answer in the box. The words are vows, union, marriage, responsible, and sanctity. The blank of man and woman is given dignity by the sacrament of matrimony. The answer is union. Next, blank is a promise, a covenant to keep the partnership for life, not only for the sake of staying together, but more for the growth and good of each other. The answer is marriage. Married couples should by all means protect the blank of their marriage and must be true to their blank. The answer is sanctity, and the other one, vows. They should be strongly united and focused not only to each other but also practice blank parenthood. The answer is responsible. Now let us proceed with our lesson. Family is a couple's desire to build after marriage. Pregnancy starts with fertilization. When a woman's egg joins with a man's sperm, fertilization usually takes place in a fallopian tube that links an ovary to the uterus. If the fertilized egg successfully travels down the fallopian tube and implants in the uterus, an embryo starts growing. An unplanned or unwanted pregnancy can cause emotional extremely pain, possible health risks, and limited life options. A pregnancy is divided into three phases called trimesters. The first trimester The first sign of pregnancy may be a missed menstrual period, from conception to the end of week 13. The second trimester, from week 14 to the end of week 26. It is the time when most women start to look pregnant and may begin to wear maternity clothes. The third trimester, from week 27 up to the giving birth. On this stage, woman's belly gets bigger. Sleep problems are common during this period. Look at the picture. Here are some maternal changes and symptoms throughout pregnancy. Pregnancy can cause some uncomfortable side effects. These include nausea and vomiting. It can be seen or it appears especially in the early pregnancy. This situation is called morning sickness. Skin changes like itchiness, pimples, stretch marks. Hormonal changes increase oil gland secretion. Breast changes, an increase in breast size, is one of the first signs of pregnancy, and the breast may continue to grow throughout the pregnancy. The same hormones make the woman's breast enlarge to produce milk. Mood swings. Some girls may also experience depression during pregnancy or after delivery. Anemia, having lower than the normal number of healthy red blood cells. Urinary tract infection, or UTI, is a bacterial infection in the urinary tract. Varicose vein, it is found in the legs and the area around the vaginal opening. A pregnant woman also experiences swelling of legs or leg cramps, tiredness, sleep problems, backache, heartburn, and constipation. Not only that, but there are also other complications during pregnancy because of the changes taking place. What are the best nutrition for pregnancy? The goal is to eat nutritious food most of the time. Failure in supplying the adequate amount of nutrients to meet pregnancy demand can lead to pregnancy malnutrition. Maternal overnutrition also has long-lasting effects on the health of the offspring. Importance of maternal nutrition. Maternal health refers to the health of women during pregnancy, childbirth, and the postnatal period. Nutrition plays a major role in maternal and child health. The ability of mother to provide nutrients and oxygen for her baby is a critical factor for pregnancy health and its survival. Foods to eat during pregnancy. A pregnant woman should focus on fruits and vegetables, particularly during the second and third trimesters. These colorful foods are low in calories and filled with fiber, protein, vitamins, and minerals. Lean protein. Pregnant women should include good protein sources at every meal to support the baby's growth. Protein-rich foods include meat, poultry, fish, eggs, beans, tofu, cheese milk, nuts, and seeds. Whole grains. These foods are an important source of energy in the diet, and they also provide fiber, iron, and B vitamins. Dairy products such as milk, yogurt, and cheese are good dietary sources of calcium, protein, and vitamin D. What to avoid during pregnancy? Aside from junk foods, drinking alcohol can harm a developing fetus, putting a baby at risk for birth defects and mental problems. Drugs. Drugs that are not prescribed by doctors, such as cocaine or marijuana during pregnancy, can cause miscarriage, prematurity, and other medical problems. Babies can also be born addicted to some drugs. When a woman smokes while she is pregnant, she can have a miscarriage or stillbirth. Her baby might be premature, born early, and sudden infant death syndrome, or SIDS. It is the sudden, unexplained death of an infant who is younger than 1 year old. Wrap up. True or false? Number 1. A pregnant woman needs to eat more than a lactating woman. The answer is false. Number 2. Pregnancy and lactation are the most important points in the life cycle to improve the nutrition of women. The answer is true. Number 3. Only children, not mothers, need vitamin A supplements. The answer is false. Number 4. Men can help improve women's nutrition by helping them with their workloads. The answer is true. Number 5. A malnourished mother will usually give birth to an infant with low birth weight. The answer is true. Valuing. Always remember, wise people make informed choices and consider the good and bad of each decision. Most importantly, you need to think about the beliefs and values you hold most of it. The sooner in pregnancy good care begins, the better for the health of both moms and the baby. The diet that is appropriate in normal pregnancy should be high in And that's all for today. I hope you learned a lot from this lesson. Thank you for listening.